The typical health destiny for most of us would be as we age, we start to get sick. And then we'll be given medications. With medications, they create side effects. And then we'll be given more drugs, more side effects, and then more drugs, and then eventually nursing home. Is that the path you want to take? Health destiny management focuses on making the right healthcare decisions so that we can guide patients to the right directions, and therefore they can reach their good destinations.
I'm a hospital CEO. I run hospitals for a living. Well, I've been in healthcare for 40 years. I've been a healthcare executive probably for about 20. The Rejenesis program for me is working out just like I expected it. I can see an overall improvement in my health, basically without having to take a lot of medication. I do take some natural supplements, but I can see that everything is on a level where you're not taking a lot of medications. You're actually doing a lot of natural work with your body and with your mind and spirit, and you're getting the best of all things that are healthy.
Besides Disneyland medicine, insurance-based medicine often fosters mediocrity. They pretty much expect doctors to practice just enough to maintain their standards so that the outcome will never be very good or very bad, just to maintain average as defined by our peers. How can real breakthrough happen without disruptive innovation?
With everything that's going on, if you remember, healthcare is probably one of the largest costs of the American economy. It's about 16 to 18% of gross domestic product. So, there's a lot of billions of dollars being spent on healthcare. And if you can, for you as a consumer, for me as a patient, for me as a consumer of healthcare, I want to make sure that I get what I want, what I need for the money that I'm spending. In Rejenesis, I find everything to that. I'm able to get a hold of him when I want. I don't call him that often, but I know that I can call him at a moment's notice and he'll either pick up the phone or send me a text. I've had some appointments with him via telemedicine where he's given me my results and things. So I think that's the way the healthcare is going. Healthcare is moving in that direction. A lot of telemedicine, teleradiology, but you still have to have that one-to-one contact with your physician, and that's most important. And that's one of the reasons I chose Dr. Chan.
In the last century, diseases are mostly infections and trauma. But nowadays, in the 21st century, diseases are mostly chronic conditions due to poor lifestyle choices that are largely preventable. We don't need more drugs, but we need better lifestyle choices with behavioral modifications.
The program works good for me. I have a lot of different services that I wouldn't really normally know about. He is always presenting a lot of new things, new ideas, new things he plans on, integrating into his Rejenesis program. He motivates me to do a lot of things that other doctors have not. I get a lot of education. I get a lot of patience. So those things are very important on the Rejenesis side versus other doctors are very nice, they're very knowledgeable. I know they are because I research them before I go to them. They just don't spend that one-on-one time, and they don't seem to give off that they want to. That's like you're a number and you're rushed through.
Unlike most of you, where you came here by chance, I came here by choice. My parents practically gave up everything for me to come here to pursue freedom and opportunities. In our sick care system, if I have chosen to only work with insurance companies, then I have already given up my freedom to practice medicine. As patients, likewise, if you only choose to work with insurance, then you too have already given up your freedom of healthcare.